Thank you very much, Trevor, and I wanted to thank the academies for having us here today to talk about Philips' strive to reach underserved populations. We have only an hour before the food arrives, so we'll be brief as much as possible. But what I will do is just give you a little bit of background into Philips' outlook. I want to touch upon transformation, and then leave you with some three thoughts that we hopefully we can discuss. If not in this session, I believe there's a question and answer session after lunch. So the first thing I would say, to try to keep it simple, because there's a lot of concepts being thrown around public-private partnerships, but the goal is really simple. The goal is to lower the cost for the government and to create greater impact. I mean, I think that's really, it's really no more complicated than that. That is the objective. And I also wanted to touch on that, and this has been brought up in different ways today, that the current environment is problematic and we are not quite there yet to really roll out PPPs in an efficient manner. So what we're going to be discussing and presenting today is where we are on our journey. We're very proud of it. We have a very interesting case to present on what we're doing in Congo, but I think it would be very practical to just realize that there's a ways to go here, and this workshop is very helpful in helping us take the necessary next steps. So within Philips, and much like Medtronic, we have our own mission statement, and for us it's to touch the lives of 3 billion people a year on the planet. The way we break that down is we have a target of 400 million people who are in underserved populations, or underserved markets or underserved populations. That's an official target of ours. By 2030, we hope to reach them. We have a formal commitment with Every Woman, Every Child to reach 300 million mothers and children. And then below that, we have a formal commitment with our partners at the UN Population Fund to reach 50 million women and girls by 2025. So we actually have a tighter timeline there. And our approach to this is really through the primary care system. There's a lot of, there are a lot of people who will tell you you can't get a return on those type of investments, but you can achieve impact, and that's, I think, where you have to keep your eyes on the ball. It's not necessarily about finding a return for your investors so much as it is to utilize capital more efficiently. And we've been at this now for 10 years. I'm very pleased that Luc de Klerk traveled for this conference because he's been there from the beginning of the journey. He piled up about 6 years of very useful experiences before we gave our effort a name, and we have an internal name in our company. We call it the Community Life Center Program, but it covers a lot of different things. And so at the present time, we've stood up 8 sites, and actually that number is probably a little bit higher. And we're executing on a number of other projects in Africa. By the end of 2020, we expect we'll be touching the lives of 1 million people. But for us, that's the first steps. This is what I was saying. We're not there yet because we can do a lot of small projects in a lot of different markets. But the real challenge is how do you do this at scale? And so transformation is really, really the key here, and it's touching everyone in the globe in various ways, but primarily through digitalization. You can't escape digitalization. It is part of the ecosystem, and it's what you do with it to try to advance healthcare solutions. So I would also say, and I'm trying to tick down the list here so we can have time to listen to the true experts on this panel, but we also are looking at our partnerships in a transformational way. Our partners are not looking at us so much as an extra source of money, but they're really tying together on the same mission goals. And partnerships are vital to the success of trying to obtain universal health coverage, because it's with the right partners that you can reduce risk. And it's only when you reduce the risk can you build a financial structure around any kind of wide-scale health systems transformation. So the 3 things I wanted to put out there for consideration is something that I learned not very long ago at a meeting that Trevor was present at, but I think it's a good one, a good idea. It's the benefit of having bilateral government-to-government MOUs in some of these countries. And the benefit is primarily to give political cover to people in the countries who could proceed on a PPP in total good faith, but still be vulnerable to criticism because the private sector is involved. And if the private sector is involved, well, then therefore there's something fishy going on. So it was an interesting idea that was raised a few weeks ago, and I'd like to put that out there for further exploration. The other thing I think is the stage that we're at for PPPs is not an investment per se, but we really need to think in terms of multi-year service agreements. That may sound trite, and they're routine in OECD countries, but when your customer is the government and they're tied to annual appropriation cycles, there's a lot of challenges as to getting governments to commit to year 2, year 3, year 4, and the multi-year service agreement is really it's a contractual vehicle. It's not an equity vehicle, but it allows companies like Medtronic and Philips and our partners to find investment at the front end to bring out the necessary digital technologies and other capital investments and spread it out over time so that the customer or the government, or however you would like to define them, is paying on a service, just on a service contract at an affordable basis. So I think multi-year service contracts are crucial for the interim period as we get, and this is my last point, and I'll turn this mic over to the next speaker. And the last point is that there are plenty of innovations, there are plenty of solutions. There's no lack of them, frankly. But the real bottleneck, at least from Philip's perspective, is the financing, the business and the financing. How do you, as one of our speakers said this morning, I think it was Emmanuel, and this is absolutely crucial, you need sustainable cash flow. That is when Philips looks at projects, and we have quite a large funnel of activities in ongoing at the moment. The ones that we identify for scaling are the ones where there are two streams of revenue, because you can't get to the destination, and the destination is frankly commercial financing. There's lots of money out there, not a lot of good projects, but all of the bankers will ask you, what's your sustainable revenue streams? So financing is really a real problem, and one of the areas that Philips is exploring at the moment, very early stage, but very seriously exploring, is the idea of setting up a primary healthcare fund. There are other funds that are available in the market. I'm thinking in terms of the medical credit fund, but that's kind of small and aimed at private clinics. There's USAID's DCA is a very nice facility, but it cuts across different sectors. It has not really developed a specialization in healthcare. And but a primary healthcare fund, if it's been supported by both the private sector and other funders, will be a source of streamlined financing, which is really imperative, because when you talk about a PPP in whatever country that you have in mind, if you're starting from scratch on the financing, it's going to double the time. It's going to take a lot of time to get it done. So those are the three thoughts I wanted to leave, just about government MOUs, managed or multi-year service contracts, and then a fund for primary care.